Hello there, my name is Michelle Williams from Edinburgh in the UK. So today we've got Jonathon Leipsic here. Thank you very much for joining us today. I'd like to ask you about TAVI imaging and TAVI CT imaging and your top tips for how to do it well.
Thank you for the opportunity and thank you for your interest. I think CT for TAVI has now asserted itself as a very important role for evaluation of patients prior to the performance of the procedure. I think historically we really focused on the iliofemoral assessment, but now I think with a well-gated, retrospectively gated study with systolic imaging, we are able now to size the annulus in a more granular fashion, allowing us to understand patient-specific geometry. Our initial focus was on how to select the transcatheter heart valve. I think now we're learning more and more that in fact CT can provide us better insight into adverse root features, presence of LVOT calcium, short or low coronary height, shallow sinuses that may actually not just define which size valve, but perhaps which platform of a valve or which type of valve to in fact select. So I really think CT, while not the only tool needed for TAVI, is truly an essential tool for the evaluation of patients prior to transcatheter aortic valve replacement.
Grand, thanks very much. And what do you think will be the next things to come along with TAVI imaging?
I mean, it's always hard to be certain with regards to prediction, but I think that, over the last 5 years, we've seen a time where CT played no role to now where we serve as the core lab for the Edwards trials, where CT is essential in device selection. I think we're going to see 3D modeling and 3D printing of CT data sets to develop, again, more patient-specific treatment strategies. And I think we're going to see CT to continue to propel itself forward in the management of not just transcatheter aortic valve disease, but with the integration of CT for transcatheter mitral valve disease, as well as other minimally invasive structural heart disease interventions. So I really think the future is very bright for CT in the structural heart disease space. I think that the challenges we had historically, we've overcome. I think the interventional field has really embraced it and is aware of its potential. And I think with further improvements in spatial resolution, temporal resolution, reduction in radiation dose, the applicability will only increase.
Grand, thank you very much. I hope you have a good meeting. So for more interviews with CT experts, visit us at youtube.com/firstinimaging. Thank you.